Respected audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 42nd lecture on pathology. Today, day 8 of Neoplasm. Day 8 of Neoplasm. Dear audience, today's topic is tumor-like conditions. Teratoma, Latent Cancer, spontaneous regression of tumor. Again, today's topic is tumor-like conditions, teratoma, latent cancer, spontaneous regression of tumor. First come to tumor-like conditions. Dear audience, previously I have told you the suffix of inflammation is itis and the suffix of neoplasm or tumor is oma. Tumor-like conditions, these are the tumor-like masses, but these are not tumor, although suffix oma is present. Again, these are tumor-like mass and there is suffix oma, but these are not tumor. These are tumor-like conditions. One is Hamartoma, another is Choristoma. First come to Hamartoma. There is suffix oma, but this is not tumor. This is tumor-like condition. What is Hamartoma? Tumor-like mass results from haphazard arrangement of cell indigenous to tissue is called hamartoma. So hamartoma, there is suffix oma, but it is not tumor. It is tumor-like mass results from haphazard arrangement of cell indigenous to tissue is known as hamartoma. Dear audience, we know tissue is composed of cell and organ is composed of tissue. In the tissue or in the organ, cells are well arranged and there is no haphazard arrangement of cell in the tissue or in the organ. If there is haphazard arrangement of the cell indigenous to the tissue makes a tumor-like mass, this is known as hamartoma. Now come to example of hamartoma. Hamartoma in lung, hamartomatous polyp in rectum, hamartoma in lung, hamartomatous polyp in rectum. First come to hamartoma in lung. Dear audience, we know within the lung there is a bronchial tree. This is the bronchial tree. You know, in the lung there is cartilage, the lining epithelium of the bronchus, there is elastic fiber, collagen fiber, nerve fibers, etc. All are the component of the lung. All the components are indigenous to the lung. So, within the lung, there is cartilage, there is elastic fiber, there is collagen fiber, smooth muscle, lining epithelium of bronchus, these are the component parts of lung. These are the elements indigenous to the lung, and all the elements are arranged well. There is well arrangement of these elements, and there is no haphazard arrangement of these elements. If the elements are arranged haphazardly, suppose this is the cartilage, this is the lining epithelium, these are the elastic fibers, and if these are the collagen fibers, this is the cartilage, lining epithelium, elastic fiber, collagen fiber. All are the component parts of the lung. All are the elements indigenous to lung tissue. If all these elements are haphazardly arranged in the lung, this haphazard arrangement of these cells or these elements of the lung produce a tumor-like mass, and this tumor-like mass is known as hamartoma. So hamartoma is a tumor-like mass results from haphazard arrangement of cells indigenous to the tissue. It is known as hamartoma, and this is hamartoma of lung. Now come to hamartomatous rectal polyp. Dear audience, there is hamartomatous polyp, there is hyperplastic polyp, there is lymphoid polyp in the rectum. Hamartomatous rectal polyp, two types. One is juvenile polyp, another is Peutz-Jeghers polyp. Now come to juvenile polyp. Juvenile polyp is one of the hamartomatous polyp that occurs in the childhood in the rectum. Childhood rectal polyp. Dear audience, we know tumor-like or tongue-like projection from the mucosa is known as polyp. Suppose this is the rectum. And this is the juvenile polyp. Dear audience, histopathology of hyperplastic polyp reveals numerous well-formed glands with back-to-back arrangement. Histopathology of hyperplastic polyp. These are the well-formed glands. These are the well-formed glands with back-to-back arrangement. This is the histopathology of hyperplastic polyp. If we see the histopathology of juvenile polyp, what we will get? Histopathology of juvenile polyp reveals tubules, not well-formed glands, and lined by mucus secreting cells. Reveals tubules lined by mucus secreting cells. If we see histopathology of hyperplastic polyp, it will reveal well-formed glands with back-to-back arrangement, but the histopathology of juvenile polyp reveals no well-formed glands, but there is tubules that are lined by mucus secreting cells. So this is the haphazard arrangement. It shows haphazard arrangement. It reveals haphazard arrangement. So this is the hamartomatous rectal polyp. Again, hamartoma is the tumor-like mass results from haphazard arrangement of cells indigenous to the tissue. It is known as hamartoma. It is tumor-like condition. It is not tumor. Now come to Choristoma. Dear audience, there is suffix oma. Although there is suffix oma, it is not tumor, it is not neoplasm, rather it is tumor-like condition. What is Choristoma? Ectopic rest of normal tissue is known as Choristoma. Ectopic rest of normal tissue is known as Choristoma. Example of Choristoma: rest of adrenal tissue beneath the renal capsule. Rest of adrenal tissue beneath the renal capsule. Dear audience, if this is the kidney, and if this is the capsule of the kidney, And if this is the adrenal, renal capsule. If underneath the capsule of the kidney there is adrenal tissue, this is known as choristoma. So rest of adrenal tissue underneath the renal capsule is an example of choristoma. Ectopic rest of normal tissue is known as choristoma. Another example is gastric mucosa in Meckel's diverticulum. Dear audience, you know, if anybody bears Meckel's diverticulum, and if there is presence of gastric mucosa in the Meckel's diverticulum, there is chance of peptic ulcer in the Meckel's diverticulum bearing the gastric mucosa. So gastric mucosa within the Meckel's diverticulum is the ectopic rest of normal tissue, is an example of choristoma. So choristoma is tumor-like mass. It is ectopic rest of normal tissue. Example, rest of adrenal tissue beneath the renal capsule, presence of gastric mucosa in Meckel's diverticulum. Now come to teratoma. What is teratoma? It is a tumor or neoplasm that arises from the pluripotent cell. Tumor that arises from pluripotent cell is known as teratoma. Dear audience, you know pluripotent cell is the stem cell in embryonal life. Dear audience, we know pluripotent cell differentiates into ectoderm, endoderm and mesoderm. Pluripotent cell differentiates to ectoderm, endoderm and mesoderm. Again, pluripotent cell is the stem cell in embryonal life and it differentiates to ectoderm, endoderm and mesoderm. So, the teratoma that arises from the pluripotent cell may contains ectodermal elements, endodermal elements and mesodermal elements also. Teratoma arising from pluripotent cell contains ectodermal, endodermal and mesodermal elements. Again, teratoma arising from pluripotent cell contains ectodermal, endodermal and mesodermal elements like dermal appendages, like hair, sebaceous gland, it may contain teeth, muscle, gut tissue, cartilage, etc. So these are the ectodermal, endodermal and mesodermal elements that is found in teratoma. Dear audience, teratoma is a tumor or neoplasm that arises from the pluripotent cell. Now come to types of teratoma. Benign teratoma, it is known as mesioteratoma also. Benign teratoma or mesioteratoma. Benign teratoma may be solid and cystic. It may be solid teratoma and it may be cystic teratoma. And the cystic teratoma containing dermal appendages is known as dermoid cyst. Cystic teratoma containing dermal appendages is known as dermoid cyst. Again, benign or mesioteratoma, it may be solid teratoma, it may be cystic teratoma. If the cystic teratoma contains dermal appendages like the hair follicles, sebaceous glands, etc., then the cystic teratoma is known as dermoid cyst. And what are the different sites of dermoid cyst? Sites of dermoid cyst. Testis, ovary, mediastinum. These are the common sites of cystic teratoma. That is, these are the common sites of dermoid cyst. So one is benign teratoma or mesioteratoma, another is malignant teratoma or immesioteratoma. Or immesioteratoma. Dear audience, teratoma is the tumor arises from the pluripotent cell. It may be benign or mesioteratoma, and it is again divided into solid and cystic. Another one is malignant teratoma or immesioteratoma. Now come to latent cancer. Latent cancer. Dear audience, we know malignant tumor is known as cancer, and malignant tumor is aggressive. Usually it metastasizes. What is latent cancer? Clinically silent cancer or malignant tumor is known as latent cancer. Clinically silent cancer or clinically silent malignant tumor is known as latent cancer. So if a malignant tumor remains clinically silent, that malignant tumor is known as latent cancer or latent malignant tumor. Now come to examples of latent cancer. One is prostatic carcinoma. Prostatic carcinoma denotes if this is the urinary bladder and if this is the prostate, you know, prostatic carcinoma occurs in the peripheral zone of the prostate. So prostatic carcinoma arises at peripheral zone of prostate. As prostatic carcinoma occurs in the peripheral zone of prostate, usually there is no compression of the prostatic part of urethra, and so there is no retention of urine, so there is no urinary complaints of the patient. Again, as the prostatic carcinoma arises in the peripheral zone of the prostate, the prostatic part of urethra is not compressed, so there is no urinary complaints of the patient. It is not locally malignant tumor. It is not locally malignant tumor. Denotates prostatic carcinoma occurs in the peripheral zone of prostate. It is not locally malignant tumor. It metastasizes. But until and unless metastasizes, it remains silent because there is no complaint of the patient. If we compare with the nodular hyperplasia prostate, you know nodular hyperplasia prostate usually occurs in the median lobe. As the median lobe is involved in nodular hyperplasia prostate, so there is compression of the prostatic part of urethra because prostatic part of urethra traverses through the median lobe. As the median lobe undergo hyperplasia, there is compression of the prostatic part of the urethra, so there is urinary complaints. So in case of nodular hyperplasia prostate, there is urinary complaints of patient, but in case of prostatic carcinoma, until and unless there is metastasis, there is no complaints of the patient. It remains silent. So prostatic carcinoma is one of the example of latent cancer. It is clinically silent. Another example, papillary carcinoma of thyroid. Dear audience, you know thyroid carcinoma may be papillary carcinoma, follicular carcinoma, undifferentiated carcinoma, medullary carcinoma. Among these, papillary carcinoma is clinically silent carcinoma. Anybody is suffering from papillary carcinoma of thyroid, usually there is no complaints. And before diagnosis of the papillary carcinoma, patient may come to you with secondaries. Patient may come to you with the nodal involvement. So, nodal involvement may be the first manifestation of papillary carcinoma. So, papillary carcinoma is clinically silent. It is one of the examples of latent cancer. Dear audience, now come to spontaneous regression of tumor. There are some malignant neoplasms there are some cancers that may undergo regression spontaneously. Some malignant tumors may undergo spontaneous regression, like neuroblastoma, malignant melanoma, choriocarcinoma. You know, neuroblastoma is a childhood malignant tumor. Malignant melanoma is a cancer of melanocyte, nevus cell. Choriocarcinoma is one of the trophoblastic tumor. These three undergo spontaneous regression. Now come to how spontaneous regression of cancer may occur. How spontaneous regression of cancer may occur. Spontaneous regression of cancer may occur by immunological reactions, by immunological reactions, or by hormonal influence. Hormonal influence. Dear audience, now come to immunological reaction and regression of tumor. Immunological reaction and regression of cancer. Dear audience, neuroblastoma, malignant melanoma, choriocarcinoma undergo regression by immunological reactions. Again, neuroblastoma, malignant melanoma, choriocarcinoma undergo regression by immunological reactions. Now come to hormonal influence and regression of cancers. Hormonal influence and regression of cancer. Dear audience, there are many hormone dependent tumors. There are hormone dependent tumors. Like carcinoma of breast, endometrial carcinoma. This carcinoma of breast and endometrial carcinoma, these are estrogen hormone dependent. These are estrogen dependent. These are estrogen dependent tumor. Dear audience, suppose mother is suffering from carcinoma breast. Carcinoma breast here. Mother is suffering from carcinoma breast. If this carcinoma breast of mother is ER positive, this carcinoma breast is ER positive. That is, it is estrogen receptor positive. Estrogen receptor positive. Again, if mother suffers from carcinoma breast and if the carcinoma breast is ER positive, that is, there is estrogen receptor within the cancer cell. So here is estrogen receptor with the cancer cell. And if this is the ovary of mother, this is ovary, mother's ovary, and ovary, you know, secretes estrogen. And this estrogen goes to the cancer of breast and it binds with the estrogen receptor and causes progression of the cancer. Again, mother suffers from carcinoma breast, and if the carcinoma breast is ER positive, mother's ovary secretes estrogen. This estrogen goes to the cancer and it binds with the estrogen receptor and it causes progression of the tumor. It causes progression of the tumor. If oophorectomy is done in mother, what will happen? If oophorectomy is done, there will be no estrogen. If oophorectomy is done, there will be no estrogen to stimulate the cancer. And in that case, there will be regression of the breast carcinoma. Again, if oophorectomy is done, there will be no estrogen to stimulate, there will be no estrogen to bind with the estrogen receptor. So, breast carcinoma will regress. This is hormonal influence associated with the regression of the cancers. Dear audience, you know carcinoma breast and endometrial carcinoma is estrogen dependent. If a mother suffers from estrogen secreting tumor of ovary, this is the ovary of mother and this is the estrogen secreting tumor within the ovary. If a mother suffers from estrogen secreting tumor of ovary and if this is the estrogen secreting tumor, it will secrete estrogen. And this estrogen may go to breast and also in the endometrium. This estrogen in the breast may produce breast carcinoma. This estrogen in the endometrium may produce endometrial carcinoma. So if there is carcinoma of breast due to estrogen and carcinoma of endometrium due to estrogen, mother is suffering from carcinoma of breast or carcinoma of endometrium or both simultaneously due to estrogen coming from the estrogen secreting tumor of the ovary. In that case, if oophorectomy is done, In that case, if oophorectomy is done, there will be no estrogen to stimulate the breast, and the breast carcinoma and endometrial carcinoma will regress. Again, if mother suffers from estrogen secreting tumor, this estrogen may act upon the breast and in the endometrium and may produce breast carcinoma and endometrial carcinoma. If so happen, in that case, if oophorectomy is done, there will be no estrogen and mother's breast carcinoma and endometrial carcinoma will regress. This is hormonal influence to regress the cancer or carcinoma. Dear audience, today I have told you about hamartoma. This is a tumor-like condition, results from haphazard arrangement of cells indigenous to the tissue. Example, hamartoma in the lung and juvenile polyp. Although there is suffix oma, it is not tumor. I have told you about Choristoma Ectopic, rest of normal tissue. Example, beneath the renal capsule, adrenal tissue, and ectopic rest of gastric mucosa in Meckel's diverticulum. I have told you about Teratoma. This is a tumor that arises from the pluripotent cell. This teratoma may contain ectodermal, mesodermal, and endodermal element. There is mesoteratoma, there is benign teratoma, and immesoteratoma or malignant teratoma. Mesoteratoma may be solid and cystic teratoma containing dermal appendages is known as dermoid cyst. It may occur in the ovary, testes, mediastinum. I have told you latent cancer, these are clinically silent cancer. Lastly, briefly, I have told you about the spontaneous regression of tumor. To adapt to this, thanks all.